They gave the rookie nurse the deaf Navy SEAL, because they wanted to watch her fail. Lily Parker was the quiet new nurse in bright blue scrubs, the one her co-workers called too soft, too nervous, and too easy to embarrass. When they pushed her into a room with a wounded SEAL who refused to let anyone touch him, the nurses at the station started laughing before she even opened the door. But the laughter died when Lily answered his frantic signs without hesitation. Not only in perfect ASL, but in a silent tactical code no civilian nurse should have known. And when the SEAL recognized the scar on her wrist, the prank turned into the first crack in a secret the hospital was never supposed to uncover. Stay with me on Fireside Files, because what happens next changes everything you think you know about this quiet nurse. The nurse station went quiet for one clean second. Then Marla Finch smiled. It was not kindness, it was cruelty wearing a hospital badge. Lily Parker stood beside the medication cart with the discharge papers pressed to her chest. Her bright blue scrubs were loose at the shoulders. Her auburn hair was twisted into a short, messy knot. A thin strand touched her cheek, but she did not move it. She had been at Franklin, Virginia Medical Center for 18 days. 18 days of being handed the worst rooms. 18 days of hearing doctors call her new girl. 18 days of letting people underestimate her, because invisibility was safer than pride. Marla tapped a pen on the desk. Room 12. Chief Caleb Rourke, former Navy SEAL, completely deaf after a blast injury. Won't read lips, won't cooperate, won't let anyone examine him unless he likes them. Resident Trevor Blake laughed. So never. Two nurses near the printer smiled into their coffee. Dr. Arthur Kincaid stepped out of the physician workroom with a tablet in one hand. He was polished, handsome, and empty in the way arrogant men often were. He looked at Lily like she was a chair placed in the wrong hallway. "Parker," he said, "you can handle basic communication, correct?" "Yes, doctor." "Good. Maybe you can charm him." Trevor lifted his phone just enough for Lily to notice. "Should we record this?" "For training." More laughter. Lily kept her face still. That made them laugh harder. Kincaid handed her the chart. "Vitals, pain score, breathing treatment if he behaves. Do not waste my time with drama." Lily looked down. Caleb Rourke, 38, retired Chief Petty Officer, Navy Special Warfare, bilateral profound hearing loss, old blast trauma, left below knee amputation, admitted after collapse during prosthetic fitting, fever, tachycardia, right rib pain, chest X-ray pending. A red note appeared 3 times. Combative, difficult, non-compliant. Lily hated those words. They usually meant someone had stopped listening. She walked to room 12 while the laughter followed her down the hall. Franklin, Virginia smelled like old coffee and antiseptic, floor wax and waiting. Veterans sat in wheelchairs by the walls. Some wore caps from wars that had ended before Lily was born. Some stared at televisions without seeing them. Some watched every doorway like exits still mattered. Lily understood that part. She stopped outside room 12 and looked through the narrow window. Caleb Rourke sat upright with his back to the wall, not the pillow. Tactical habit. Never leave a blind side. Never lie flat when strangers controlled the room. He was broad through the shoulders, even in a hospital gown. His beard was trimmed close. A scar crossed his temple into his hairline. His pale blue eyes moved from door to window to oxygen port to sharps container. He was not combative. He was mapping threats. 2 orderlies stood near the bed, nervous and useless. A tablet lay cracked on the floor. The whiteboard read, "Patient deaf. Use tablet." Lily knocked twice on the frame. Caleb's eyes snapped to her hands. Good, he was watching the right thing. She entered slowly, palms visible, body angled away from the door so he did not feel trapped. The orderlies looked relieved. "Good luck," one said. "You can leave," Lily answered. "You sure?" "Yes." They left fast. Lily kept the door open and raised her hands. My name is Lily. I am your nurse. I will not touch you without permission. Caleb froze. Not because she signed well. His hands moved fast. You sign? Yes. Who taught you? A friend. Name? Lily tilted her head. You ask every nurse for references. His eyes narrowed. Funny. Sometimes. The corner of his mouth shifted. Not a smile, a crack in the wall. He signed again. No students. No Blake. No Kincaid. No restraints. Agreed, unless you become a danger to yourself or others. I am not the danger. Lily heard the weight behind that. She turned to the whiteboard and wrote in large letters. SL Primary. No touch without consent. No students without consent. Then she faced him again. May I check your vitals? He held up one finger. Question first. Go. What did they say about me? Lily did not soften it. That you are difficult. And you. I think you are in pain and tired of being misunderstood. The room settled around that sentence. Caleb stared at her for a long time. Then he nodded once. She wrapped the blood pressure cuff around his right arm. Her touch was careful. No surprise pressure. No cold metal against jumpy skin. No hand on his shoulder like people did when they wanted control. The machine inflated. 158/94. Pulse 124. Oxygen 93. Temperature 100.9. She counted respirations herself. 28 too fast. His right hand stayed near his lower ribs. Lily pointed. Pain there. Yes. Since when?
Notice the ground beneath him was not solid. The rapid response this morning. Worse after prosthetic clinic? Yes. Fall? No. Tight? Hard to breathe? Yes. She listened to his lungs after asking permission. Left side course. Right lower field diminished. Not absent, not yet. But wrong. She stepped back. You need reassessment. He watched her face. Doctor said anxiety. Doctor is wrong. Caleb's expression changed again. You military? No. Lie. Nurse. That is not an answer. It is the answer I am giving. He studied her stance, her hands, the way she kept the bed between him and the door, without blocking either. Then his fingers moved in a different language. Not ASL. Short, sharp, silent. Team code. Pain spreading. Breath short. Internal problem. Lily's blood went cold. No civilian nurse should have recognized it. No ordinary veteran should still use it. Those signals belong to men who worked without radios, without light, without a second chance. Caleb saw the recognition before she hit it. His eyes widened. He signed the sequence again, then added one word. Identify. Lily should have looked confused. That would have been safe. Instead, his oxygen dropped to 91. She answered with one tactical sign. Hold. I see you. Caleb stopped breathing for half a second. His eyes locked on her left wrist. A thin, pale scar disappeared under her watch. Rope burn. Old. Clean. His hands moved slower now. Sparrow? Lily stepped back. No. Sparrow died. Then let her stay dead. Here's the twist nobody at Franklin, Virginia saw coming, and it's exactly why Fireside Files needs you to keep watching. The door opened before he could answer. Marla stood there with Trevor behind her, his phone half hidden. Why are the blinds closed? Marla asked. Because he deserves privacy. Trevor smirked. Or because you are in over your head. Lily moved to the hall. Room 12 needs Dr. Kincaid. Now. Kincaid arrived with his tablet and irritation. What did he do? He did not do anything. His status changed. Pulse 124. Respirations 28. Fever 100.9. Oxygen dropped from 93 to 91. Right lower breath sounds diminished. Acute rib pain. Kincaid looked at Caleb through the doorway. Panic. No. The hallway chilled. Kincaid turned slowly. You have been here 18 days. And his lungs have been getting worse for 20 minutes. Trevor whispered, rookie diagnosing seals. Kincaid's voice hardened. Order a breathing treatment. Document anxiety. That is not the problem. Do it. He needs imaging reviewed. He needs a nurse who follows instructions. Lily met his eyes. For a moment, no one spoke. Then Kincaid leaned closer. You are not special, Parker. You are not brave. You are not the first new nurse who wanted attention. Lily felt the old anger rise, cold, never hot. If attention oxygenated patients, doctor, he would be cured. Marla inhaled. Trevor's smile dropped. Kincaid's face flushed. You will give the treatment. You will not escalate without my order. Clear? Clear. Lily returned to Caleb. Clear did not mean obedient. It meant she understood exactly what kind of man was now in the way. Caleb signed as soon as the door closed. Dr. Stupid. Not chart language. Use better chart. Despite herself, Lily almost smiled. Then his face tightened. His hand pressed harder into his ribs. The monitor climbed to 132. Worse. Yes. He signed again in team code. Pressure. Right. Bad. Now. Lily grabbed oxygen tubing and placed it after he nodded. He did not fight her. That alone would have shocked the hall. His oxygen dropped to 89. Kincaid came in with Marla and Trevor. What did you do now? His saturation is falling. Kincaid looked at the monitor. For the first time, irritation cracked into uncertainty. Then pride sealed it again. 2 milligrams lorazepam, he said. Caleb read enough from his lips. His face hardened. No sedative. Lily stepped between him and Marla. No. Kincaid stared. What did you say? No sedative until respiratory cause is ruled out. You do not countermand me. You do not sedate a man who cannot breathe. The oxygen dropped to 86. The alarm chirped. Lily hit the rapid response button herself. The announcement cracked through the unit. Rapid response room 12. Rapid response room 12. Kincaid lunged for the cancel switch. Caleb grabbed his wrist. Not hard enough to harm. Hard enough to stop. Lily signed once. Release. Caleb released immediately. That obedience silenced the room. Kincaid stared at Lily as if he had just say team rushed in. Nina Cho from respiratory arrived first. What have we got? He was at 79%. Warren turned to Lily. Good save. Chest tube, now. 2 words. Good save. They hit Lily harder than insult. Lily looked down at the floor for 1 second. Blood had not spilled here. No smoke filled the ceiling, no rotor wash shook the walls. Still, her body remembered a colder room, a darker one. A place where a man had gasped exactly like Caleb, and a commander had waited too long for confirmation. She pushed that memory down. Caleb needed present time, not ghosts. Warren prepared the chest tube tray, while Nina adjusted oxygen. Marla stood near the foot of the bed with her hands locked together. Trevor no longer recorded. His phone had vanished into his pocket, but Lily had seen enough to remember. Kincaid tried to reclaim command by clearing his throat. I will supervise. Warren did not look at him. You will stand where you are not in the way. A few heads turned. Nobody laughed. That was when Lily understood the room had changed. Not because they respected her yet. Respect took longer. The room had changed because certainty had cracked. They had been sure she was weak, sure Caleb was impossible, sure Kincaid was right because his coat was long and his voice was loud. Now Caleb breathed because the quiet nurse moved faster than the loud doctor. That kind of truth could not be unseen. Caleb signed through the oxygen mask. You hate attention. Lily answered without looking up from the drainage line. More than chest tubes. He winced, but his eyes warmed. Then choose better hiding place. I tried. Bad choice. She almost told him he was right. Instead, she checked the clamp, checked the seal, and wrote the time in the chart with the same controlled handwriting she used for everything that hurt. Caleb watched her like he had found a ghost, and was afraid blinking would make her vanish. By the time Caleb reached step down, the whole unit had invented a different version of what happened. The rookie stabbed a seal with a needle. The deaf patient only obeyed her. Dr. Kincaid almost lost a man. Parker used secret hand signals. Parker might be military. Parker might be dangerous. Lily heard the whispers and kept walking. She had survived worse than whispers. Caleb lay in the step-down bed with a chest tube secured to his right side. The chamber bubbled softly. His color had improved, but pain still carved lines around his eyes. Dr. Warren had ordered CT, antibiotics, careful pain control, and no sedation without respiratory review. Kincaid hated every word. Lily documented everything. Every vital sign. Every refusal. Every delay. Facts were cleaner than revenge. At 3:10 p.m., Marla found her in the supply room. Administration wants you. Is Caleb stable? Warren is with him. Then I'll go. Marla blocked the doorway for 1 second. Lily. Lily waited. I laughed. Yes. I thought it would be harmless. Humiliation is never harmless. It only looks small to the people watching. Marla flinched like she deserved it. The administrative conference room sat far from alarms and blood. Framed values hung on the wall. Respect. Integrity. Service. Lily always noticed when values needed frames. People living them rarely needed reminders. Dennis Pruitt, the hospital administrator, sat at the head of the table.
Kincaid sat to his right.
Trevor Blake sat beside him with his arms crossed. Marla took the chair closest to the door. Nurse Parker, Pruitt said. Sit. I prefer to stand.
Kincaid scoffed.
Pruitt tapped his pen. We are reviewing a serious incident involving unauthorized intervention. A life-saving intervention, Lily said. Kincaid leaned forward. You do not decide that. His oxygen saturation did. Pruitt lifted a hand. Did you perform needle decompression on Chief Rourke? Yes. Are you credentialed here to perform that independently?
No.
Were you instructed by the attending physician not to proceed? Yes. Kincaid smiled. Lily did not look at him. Pruitt wrote something. Then you understand the concern. I understand the liability concern. The clinical concern was breathing. Silence. Pruitt looked up. You seem calm for someone facing termination. Lily said nothing. Calm had been trained into her in places where panic killed faster than bullets. Kincaid opened a folder. There is another concern. Chief Rourke called you something. Sparrow. Pruitt looked from Kincaid to Lily. What does that mean? Ask him. We are asking you. I do not know what he meant. Kincaid smiled again.
Lie.
Something changed in the air. Small. Enough for Marla to sit straighter. Lily turned her head toward him. You should be careful with that word. Or what? Her voice stayed soft. That depends on how many more patients you plan to ignore. Pruitt slapped the table. This meeting is not about Dr. Kincaid. It should be. Kincaid stood. You are not some battlefield hero here, Parker. This is a hospital. We have hierarchy. Lily held his eyes. Hierarchy does not oxygenate a patient. The door opened. Dr. Warren walked in with Caleb's updated report. I heard there was a review. Pruitt forced a smile. This is internal.
No.
It is patient safety. Warren placed the report on the table. Chief Rourke had a clinically significant pneumothorax with small hemothorax. Delay would have worsened his outcome. Parker acted correctly. Pruitt read fast. Kincaid stared at the wall. Warren looked at Lily. Did he consent? Yes. In his primary language? Yes. Then I'll defend the intervention. Pruitt cleared his throat. Scope still matters. Warren's eyes hardened. So does survival. The door opened again. This time, the room stopped. Caleb Rourke stood in the doorway in a hospital gown, chest tube chamber hanging from one hand, for pole gripped in the other. A step-down nurse hovered behind him, horrified. I tried to stop him, she said. Caleb ignored her. Lily moved first. You should not be walking. He signed one-handed, then stopped. Pruitt stood. Chief Rourke, return to your room. Caleb looked at Lily. Translate.
She did.
Caleb's response came sharp. She saved my life. You mocked me.
You spoke over me.
You tried to drug me because understanding me was inconvenient. Lily translated every word. Marla closed her eyes. Trevor stared at the table. Kincaid's mouth tightened. Caleb pointed at Lily. She listened. Then he signed in team code, not ASL. Identity confirmed. Sparrow alive. Lily did not translate. Caleb knew she would not. So he spoke. His voice was rough from years without hearing himself, but the word was clear. Sparrow. The room went dead silent. He pointed at Lily. She was there. Pruitt whispered. Where? Caleb looked at Kincaid. Where men like him would have died in 10 minutes. Then his knees buckled. Lily caught him before anyone else moved. Chair, she snapped. Marla moved fast. Warren grabbed the chest tube line. Trevor stood frozen until Warren shouted for oxygen. Caleb's pulse was rapid, his pressure dipped, then steadied as they lowered him into a chair. Lily held the tube upright and kept his eyes on her hands.
Breathe.
Stay with me. He signed weakly. Not leaving again. You are not leaving anything if you rip that tube out. Even in pain, his mouth twitched. Warren ordered him back to step down. Pruitt said, This review is not over. Warren looked at him. Then schedule it when your witness is not attached to drainage equipment. As they rolled Caleb out, staff lined the hall. No one laughed now. Lily walked beside the wheelchair. Caleb's hand rested where she could see it. They know now. They know a word. Words open doors. Then I'll close them. Not this one. They got him back into bed. Warren checked the tube, adjusted orders, and left with a warning that no one was to question Caleb without Lily or another qualified interpreter present. While Caleb rested, the hospital kept talking. At the nurse station, 2 techs stopped mid-sentence when Lily passed. In the medication room, someone whispered that she had military eyes. Near radiology, a resident asked whether women could even be SEALs, then went silent when Dr. Warren walked by. Lily heard all of it. She did not correct them. Correction invited more questions. Silence gave people enough rope to reveal themselves. But the whispers did something she had not expected. They reached the veterans first. An old Marine in room 9 lifted 2 fingers when she walked past. Not a salute, not exactly. More like recognition, from one survivor to another. A Vietnam veteran near the windows looked at her wrist, then at her face, and nodded once. A younger amputee in the hallway stopped complaining about discharge paperwork long enough to say, Chief Rourke breathing better?
He is, Lily said. Good.
Somebody finally listened to him. Those words followed her all the way to step down, because that was the real wound in the building. Not deafness, not trauma, not missing limbs or nightmares. The wound was how many people had stopped expecting to be heard. Lily had come to Franklin, Virginia to disappear among people who understood silence. Now she saw the mistake. Silence was not always peace. Sometimes silence was what remained after too many people had been ignored. When the room emptied, Caleb watched Lily write notes. You cannot keep pretending. Watch me. They will dig. Let them get tired. Kincaid won't. Lily glanced toward the hall. Kincaid stood near the desk with Trevor. They were talking low. Kincaid looked angry. Trevor looked afraid. Caleb signed slower. I searched for you after Black Currant. Lily stopped writing. Do not. They said Sparrow drowned cutting Bishop free. Many people died. Bishop lived because of you. Bishop lost a leg because of me.
Wrong.
He lost a leg because a charge went off under Hull. He lived because you went back. I went back too late. You went back without a line. Lily looked away. Her left wrist burned under the watch. Caleb's next signs were gentle. Guilt edits better than truth. That one hurt because it was true. A knock came. Marla stepped inside. She looked smaller than she had that morning. Kincaid is saying you manipulated him. Of course he is. He says you escalated Chief Rourke on purpose. Caleb gave Marla a look that needed no translation. Marla swallowed. I know that is not true. Lily capped her pen. Knowing truth quietly does not help patience. Marla's eyes filled. I am sorry. Are you sorry because you were cruel, or because cruelty got witnessed? Marla looked down. I don't know yet. It was the first honest thing she had said all day. Lily nodded. Figure it out. Marla left. Caleb watched the door close. You collect broken people. I collect vital signs. Same thing in this place. The unit lights flickered once, twice. The monitors chirped, recovered, then steadied. A maintenance announcement crackled overhead. Temporary power fluctuation, system stable. Everyone relaxed. Lily did not. Caleb saw her expression change. What? Maybe nothing. Lie. She moved to the doorway. The hall looked normal. Too normal. A transport cart near the medication room. A janitor by the trash. A family member at the desk. Then Lily saw Trevor at the far end of the hall. He stood beside a man in a dark maintenance jacket. The man wore a Franklin, Virginia badge turned backward. His shoes were wrong, too clean, soft soles, no scuffs. Trevor handed him something small. A key card. Lily stepped back into the room and picked up the phone. Marla, lock the medication room. Check oxygen access panels, near step down. What?
Now.
Something in Lily's voice made her obey. Caleb pushed himself up. Threat. Unknown male. Bad badge. Trevor gave him access. Target. Lily looked at the chest tube. Maybe you. His eyes narrowed.
Or you.
The overhead speaker cracked. Code Silver, main lobby, security response. If you've made it this far on Fireside Files, you already know this story is about to explode, so stay close. The hallway erupted. A scream rose near the elevators. Lily closed Caleb's door, pulled the blinds, and dragged the heavy recliner against it at an angle. Caleb signed one-handed. Give me chair.
No.
I can help. You can breathe. He glared. She ignored him and lifted the metal four-pole. Not like a frightened nurse, like a weapon measured for distance. Caleb stared. There you are. Footsteps approached. Fast, then slow. The door handle moved. The recliner caught the push. A shoulder hit the gap. Dark jacket, wrong shoes, right hand hidden. Lily struck the wrist with the four-pole. The object fell. Not a gun, a syringe. The man lunged. Lily hooked the pole behind his knee and drove him into the doorframe. He hit hard. Caleb ripped the call cord from the wall and looped it around the man's arm when he fell within reach. Even attached to a chest tube, the SEAL knew how to fight. Lily pinned the man's wrist with her shoe. Do not move. Her voice was quiet. That made it worse. Security arrived late and loud. 2 guards stopped in the doorway, stunned by the scene. The rookie nurse stood over a man twice her size with a four-pole in both hands. The deaf Navy SEAL sat upright in bed with a call cord twisted around the attacker's arm. Clear fluid leaked from the syringe onto the tile. Marla appeared behind security, her face strained. Lily looked at the nearest guard.
Gloves.
Evidence bag. Do not touch the needle barehanded. Call pharmacy. Find Trevor Blake. The guard blinked. Ma'am, step back. Lily lifted her eyes. I said, find Trevor Blake. He moved. Not because he understood, because some voices gave orders before rank arrived. Kincaid rushed around the corner. What happened? Caleb pointed at the attacker, then at Lily. She saved me again. This time Lily translated. Pruitt arrived with 2 administrators and a security supervisor. What is going on? Lily stepped back as the guard secured the man. Attempted patient assault. Possible medication tampering. Insider access. Dr. Blake gave this man a key card. Pruitt stiffened. That is a serious allegation. Then start treating serious things seriously. Down the hall, a guard shouted. Found Blake near the south stairs. Trevor's voice cracked. I didn't know what he was going to do. Caleb's face darkened. The security supervisor asked, how did you know he was coming here? Every face turned toward Lily. Kincaid's, Marla's, Pruitt's, Trevor's, pale between 2 guards. Caleb looked at Lily. He did not sign now. He spoke. Because she was trained to know. Pruitt whispered. Trained by whom? The man on the floor lifted his head and smiled at Lily. You should have stayed dead, Sparrow. The hallway froze. Caleb signed one word. Trap. Lily lowered the four-pole slowly. Her eyes locked on the attacker. You know me? Everybody from Black Current knows you. Marla covered her mouth. Kincaid looked like the floor had opened beneath him. Lily straightened. The bright blue scrubs no longer made her look small. They made everyone else look unprepared. Lock down the south stairwell, she said. The security supervisor hesitated. Ma'am, lock it down. Pull cameras from prosthetics, pharmacy, service elevators, and this hall. No one leaves the wing until federal police arrive. Pruitt blinked. You do not have authority to order that. Caleb signed from the bed, slow but clear. Lily translated, because hiding no longer mattered. He says I do. Kincaid's voice broke. What does that mean? The attacker laughed. Lily stepped closer to him. It means your little prank just walked into a classified crime scene. The attacker did not look like a desperate man. That bothered Lily most. Desperate men shook. Angry men shouted. This one smiled from the floor while security cuffed him, as if being caught was only one step in someone else's plan. His eyes kept moving to the hallway clock. Lily noticed. Caleb noticed her noticing. Timer, he signed. Maybe. Pruitt's face colored. This is not a stage for jokes. No, Lily said. It is a patient care wing with a possible hostile breach, a missing evidence drive, an assaulted veteran, and at least one insider. Ward stepped closer. Confirmed? Where? She scanned the room. Oxygen port, sharps bin, medication drawer, ceiling tile above the sink. Nothing obvious. That did not comfort her. The best traps were never obvious. Clear adjacent rooms, she told the security supervisor. Start with oxygen access and electrical panels. Pruitt snapped. You are creating panic. No, Lily said. Panic is when untrained people realize too late that they ignored the warning. Marla turned to the nearest nurse. Move rooms 10 and 11 now. Pruitt stared at her. Marla's face shook, but her voice held. You heard her. For the first time that day, Marla chose a side while it still cost her something. Lily saw it. She did not praise it, not yet, but she saw. Trevor began crying near the stairwell. It was just a records job, he kept repeating. He said Chief Rourke had something that could hurt people. Caleb's eyes sharpened. Something? Lily turned toward him. What did you bring to this hospital? Caleb hesitated. That hesitation answered before his hands did.
File.
Prosthetic case. Hidden drive. Evidence from Black Current. Lily felt the room tilt. Where is it? He signed one word. Missing. At the far end of the hall, the elevator opened. Two naval investigators stepped out with badges raised. Behind them came a silver-haired Navy captain with a face like carved stone. He looked at Caleb, then at the attacker, then at Lily Parker. The captain stopped cold. Sparrow? No one moved. Lily closed her eyes for half a second. When she opened them, the rookie nurse was gone. Captain, she said. The word was quiet, but it silenced the entire wing. Captain Elias Ward did not say the name again. He did not need to. One word had already changed the temperature of the entire wing. Sparrow. Lily Parker stood in bright blue scrubs with one hand near Caleb Rourke's bed rail and the other still marked by the pale scar on her wrist. Around her, nurses froze with medication cups in their hands. Residents stopped pretending they were busy. Dr. Eleanor Pruitt broke first. Captain, this is highly inappropriate. Nurse Parker is a probationary hire with no authority over hospital security. Ward's eyes did not leave Lily. Probationary. Pruitt lifted her chin. Yes. And currently under review for insubordination. Caleb signed something from the bed. Lily did not translate. Ward looked at Caleb, then back at Lily. What did he say? Lily kept her voice flat. He said you should arrest the review board first. A sound moved through the hall. Not laughter, something tighter, shock trying not to become admiration. Not all of it. Your assessment? Trevor Blake was used. The attacker knew my call sign. Chief Rourke came here with black current evidence hidden in his prosthetic case. That case is now missing. The attacker watched the clock after he was caught. Ward turned to the two naval investigators. Secure prosthetics, pharmacy, records, and loading dock. They moved at once. Pruitt raised a hand. You cannot simply take over VA facility. Ward finally looked at her. Ma'am, I have a wounded Navy SEAL, a classified evidence chain, and a compromised federal wing. I can. The hall went silent again. Kincaid cleared his throat. Captain, no one here knew about any evidence. We were treating a difficult patient. Caleb's eyes burned. Lily signed to him. Stay still. He signed back hard. Not difficult. I know. Then his face changed. Not anger, pain. His right hand pressed into his ribs. His breath shortened. The monitor beside him began to chirp faster. Pulse 132. Oxygen 88. Lily moved before anyone else understood. Get me a non-rebreather. 15 liters. Marla, call rapid response. Trevor, do not touch him. Kincaid, ultrasound now. Kincaid snapped out of his fog. You do not order physicians. Lily pointed at the monitor. Then act like one. Caleb's chest barely rose on the right. His eyes locked on hers. Air, he signed with one trembling hand. Yes. Leak. Maybe worse. The attacker on the floor began laughing. Lily turned sharply. What did you do? He smiled through blood on his lip. Nothing. He was already breaking. Marla returned with oxygen. Her hands shook, but she placed the mask correctly. Lily raised Caleb's head, checked his tracheal position, watched the veins in his neck stand out. Oxygen 84. Blood pressure falling. Kincaid rolled in the ultrasound with jerky movements. He placed the probe wrong twice. Lily saw enough anyway. No lung sliding on the right. Tension pneumothorax. He needs decompression now. Kincaid swallowed. We need radiology confirmation. He'll arrest before radiology. Pruitt said, follow hospital protocol. Lily looked at her. Protocol does not require us to watch a man suffocate. Kincaid's voice cracked. I have not done one outside simulation. Caleb's eyes went glassy. Lily's past came for her in pieces. A dark room under green light. A teammate bleeding silently. Caleb, younger, hearing, then shouting that the ceiling was going to come down. Her own hands punching a catheter into a chest while dust fell like snow. Back in the hospital, the monitor screamed. Oxygen 79. Caleb's fingers twitched against the sheet. He signed one word. Sparrow. Lily grabbed a 14-gauge angiocath from the procedure cart. Ward stepped into Pruitt's path before she could interfere. Let her work. Kincaid stood frozen. Lily cut Caleb's gown down the side. She palpated the second intercostal space, midclavicular line, then adjusted lower because his anatomy and scar tissue changed the landmarks. Her thumb found the space. Caleb, eyes on me. His eyes found hers. This will hurt. He signed weakly. Been worse. She drove the catheter in. A hard hiss of trapped air escaped. The whole room heard it. Caleb's chest rose. The monitor climbed. 79 became 84, then 89, then 92. No one spoke. Lily taped the catheter, kept one hand on his shoulder, and watched his color return by degrees. Marla whispered, How did you know? Kincaid stared at the catheter like it had appeared from nowhere. Pruitt's mouth opened, but nothing came out. Ward looked at Lily with the weight of history in his face. Black current. Second tunnel. Lily did not answer. Ward's voice softened. You did the same thing there. Caleb signed slowly. Every movement heavy. Saved 6. Lost none. Lily's jaw tightened. 1 lost. Caleb shook his head. Not yours. The words hit harder than any accusation. The attacker stopped smiling. That was the moment Lily understood he had not expected Caleb to survive. Captain, she said. Ward heard the change in her voice. What? The drive is not the only target. Lily looked at Caleb's decompression catheter, then at the attacker. They wanted him dead before he could identify what was missing. The naval investigator nearest the stairwell shouted, "Captain, prosthetics lab is empty.
Case is gone.
Security footage erased for the last 11 minutes. Trevor Blake slid down the wall, shaking. I didn't know. Lily turned to him. Who told you to send me into his room? Trevor looked at Kincaid. Kincaid stepped back.
No.
Marla covered her mouth. Pruitt's eyes moved once, not toward Kincaid, toward the staff elevator. Lily saw it.
So did Ward.
Lock the elevator, Ward ordered. Too late. The doors opened at the end of the hall. A man in a maintenance uniform stepped out carrying a hard black prosthetic case. For 1 second, everyone saw him. Then the lights went out. Emergency red filled the wing. A child visiting his grandfather screamed from somewhere behind the nurse's station. The attacker on the floor shouted, "Now!" Lily moved toward Caleb's bed. Ward drew his sidearm. The maintenance man ran. And in the red flashing dark, the rookie nurse everyone had mocked became the only person moving without fear. Lily did not chase the man first. That surprised everyone except Caleb. She turned toward the patients. Marla, doors shut. Move visitors behind the nurse's station. Keep Caleb upright. Do not remove that catheter. If his oxygen drops below 88, call it out. Marla's voice shook. I can do that. Then do it. Ward pointed down the red-lit hall. Sparrow, he has the case. I know. You are letting him run. No, Lily said. I am choosing not to abandon a patient wing during a blackout. For the first time, Ward almost smiled. Still you. Kincaid shouted from near the wall. Someone get the lights back. Lily snapped her gaze to him. Stop yelling. You're helping him track us. Kincaid closed his mouth. That alone felt historic. The emergency lights pulsed over wheelchairs for poles, oxygen tanks, and frightened faces. Veterans who had slept through ordinary hospital noise were awake now. They knew what darkness meant. They knew when a building stopped being safe. Caleb signed from the bed. Status. Lily answered. Breathing first, evidence second. Revenge, never. His mouth tightened. The attacker on the floor laughed. You still talk like a field manual, Sparrow. Ward crouched beside him. Name? The man smiled. Ask her. Lily stepped closer. Damon Vale. Ward's jaw tightened. Black Current.
No.
He sold us the map that turned Black Current into a grave. Damon's eyes brightened. 7 men trapped, 1 woman buried. And yet, here she is, playing nurse in a VA ward. Pruitt whispered, What is Black Current? Ward did not look at her. A classified operation you are not cleared to discuss. Damon looked toward Kincaid. But some people here were cleared to be useful. Kincaid recoiled. I have never seen this man. Trevor Blake slid down the wall. He had your badge. Kincaid turned on him. Shut up. Lily moved so fast Kincaid flinched. Do not threaten him. Trevor's voice cracked. He showed me an approval message from Dr. Kincaid. Said Chief Rourke had stolen military property. Said if I helped isolate him, I'd get a fellowship recommendation. I thought it was an audit. Marla stared at Kincaid. You used us. Kincaid pointed at Lily. She is the one with a hidden identity. And you are the one whose badge opened prosthetics. Ward's radio crackled. Captain, loading dock clear. We found the prosthetic case. Lily's eyes sharpened. Do not open it. A beat. It is already open. Empty. Lily exhaled. Of course it was. The case was bait. A metallic clatter sounded above respiratory storage. Lily raised one finger. Quiet. Everyone obeyed. Even Pruitt. Another clatter. 3 panels down. Ward signed without thinking. 2 suspects. Lily answered in the old code. 1 running, 1 waiting. Caleb's eyes widened. Ambush. Lily nodded. Captain, keep 2 on Caleb. Lieutenant Dane with me. Marla, if anyone tries to move him, scream first and ask questions later. Marla swallowed. I can scream. I noticed. That nearly broke the tension. Lily moved toward respiratory storage with Dane behind her. No weapon, no armor, just scrubs, trauma shears, and the calm of someone who had already made peace with fear. Dane whispered, "Are you really Sparrow?" "Not today." "What are you today?" "A nurse." They reached the storage door. It was locked. Dane reached for a breaching tool. "Too loud," Lily whispered. She removed a thin metal clip from her badge reel. Dane stared as she opened the old latch in 4 seconds. Inside, the room smelled of plastic tubing and dust. Shelves rose high with nebulizer kits, masks, and portable oxygen tanks. A ceiling tile shifted. Dane aimed up. "Federal officer. Hands where I can see them." No answer. Lily saw the trap 1 second before Dane stepped under it. An oxygen tank sat on the top shelf, with its valve cracked. Beside it, a tiny spark module blinked under tape. Not a bomb. Worse, in a hospital, a fire starter in an oxygen-rich room. "Back." Dane moved because her voice left no room for pride. Lily grabbed a fire extinguisher and struck the module off the shelf before it cycled again. One bright spark snapped. Foam swallowed it. The oxygen hiss continued. She closed the valve. Dane stared. That would have burned the wing.
No.
It would have filled it with smoke. And during evacuation, they take Caleb. A shout came from room 12. "Lily! Marla!" Lily ran. Kincaid had moved toward Caleb's bed with a syringe in his hand. Ward had him pinned against the wall. Marla stood between Kincaid and Caleb with both arms spread wide, shaking but planted. Ward's voice was low. "What is in the syringe?" Kincaid gasped. "Sedative." He was agitated. Lily checked the label. "Wrong drug. Wrong dose. Wrong lie." Caleb signed with one hand. "He tried to silence me." Kincaid snapped. "He is deaf." The room went still. Lily's voice dropped. "Deaf does not mean voiceless." Ward handed the syringe to Dane. Dane cuffed Kincaid. Pruitt looked ill. "Arthur, what did you do?" Kincaid laughed once. "What I had to. Veterans come in with complicated injuries and federal records. Contractors pay to keep certain mistakes buried. Everyone takes something." Marla whispered. "People were hurt." "People are always hurt." Lily stepped close.
No.
"People were trusted to you." Kincaid's eyes flicked toward Caleb. He was going to release files, names, contracts, medical reports. "Do you know what that destroys?" "Lies. Careers." "Same thing, if the career was built wrong." Caleb's monitor alarmed again. Oxygen 87. Lily turned from Kincaid instantly. "Patient first. Always. Chest tube kit. Trauma surgery now." Marla moved before anyone else. Caleb caught Lily's wrist. "Drive," he signed. "Later."
Now.
He pointed to his prosthetic liner on the chair, not the missing case. The liner. Lily reached inside the foam sleeve. Her fingers found a seam. A tiny waterproof drive slid into her palm. Caleb's mouth formed one silent word. "Back up." Lily almost smiled. Then Damon shouted from the hall. She found it. The north stairwell door slammed open. Boots thundered toward the ward. Ward raised his weapon. Lily put the drive into her glove and looked at Caleb. "How many?" Caleb felt the vibration through the bedrail. His eyes counted what his ears could not. 3. Lily nodded. The hospital had mocked the rookie nurse for being quiet. Now, quiet was the only advantage they had. Lily killed the local alarm before the attackers reached the nurse's station. The red strobes kept flashing. The shriek stopped. The sudden silence was colder than noise. Ward understood. Everybody down. Veterans lowered themselves behind chairs, counters, carts, and door frames. Old bodies, bad knees, trembling hands. Still, they moved with a discipline that made Lily's throat tighten. Marla crouched beside Caleb's bed. "What do I do?" "Watch his lips and chest. If he fades, hit the code button twice." "He cannot hear me." "He can see you." "That is enough." Caleb signed to Marla. "Thank you." Marla signed back, badly. "Sorry." Caleb stared at her, then nodded once. Not forgiveness, a door. The 3 men came around the corner wearing hospital jackets over tactical vests. No rifles, handguns low, surgical masks up. They expected panic. They found silence. Ward fired once into the floor near their feet. Federal officers dropped the weapons. They split. One ducked behind the linen cart. One moved toward the medication room. The third stayed center, searching faces, searching for Lily. She slid behind the supply alcove and signed across the hall to Caleb. Center is leader. Left shoulder injured, right nervous. Caleb answered. Leader watches your hands. Then one more sign. Tunnel. Black current returned in pieces. A coastal weapons facility, bad maps, bad intelligence, contractors who had sold two sides the same route. Caleb, with hearing intact, laughing in the dark to keep younger operators steady. Lily, with a medical pack and a rifle, call sign Sparrow because she slipped through impossible spaces and came back carrying wounded men. Then the blast. Then Caleb screaming, until silence swallowed him. Then the Navy burying Sparrow on paper, because her testimony could expose men too protected to touch all at once. And now, those men had found Caleb. The center attacker raised his weapon toward room 12. Lily stepped out. Looking for this? She held up her gloved fist. All three turned. Ward whispered, Sparrow, no. But she was already moving. The leader rushed her with the clean confidence of a man used to civilians freezing. Lily did not freeze. She threw in 4 pulls sideways into his knee. His shot went high and shattered a light cover. Lily closed distance. Elbow to wrist, palm to throat, knee to thigh. His weapon clattered across the floor. The second man came from the medication room. Dane tackled him into the wall. The third aimed at Marla. Caleb moved despite the pain. He swung his prosthetic liner from the bed. It hit the man's wrist hard enough to send the shot into the ceiling. Marla screamed exactly as instructed. 2 code presses. White lights flashed over red. Hospital security poured from the stairwell behind Ward's team. The fight lasted 9 seconds. That was what no one understood about train violence. It did not look like movies. It looked like a door slamming shut. Fast, ugly, final. When it ended, Lily stood over the leader with his wrist locked and her knee on his shoulder. Her hair had come loose, her scrub sleeve was torn. Her face was calm. Trevor stared from behind the counter. She is a nurse, he whispered. Ward holstered his weapon. She is also the reason several men are alive who should not be. Pruitt gripped the nurse's station. What is she? Caleb answered before Ward could. His signs were sharp, proud, and shaking. Lily translated because the hallway needed to hear it. He says, I was Special Warfare Operator Lily Parker. Call sign, Sparrow. Attached to a Navy SEAL medical assault element. Black current survivor. Silver Star recipient. Presumed dead by design. The words landed like blows. Kincaid, cuffed near the wall, whispered, Impossible. Lily looked at him. You built your life on underestimating people. Of course, truth feels impossible. Ward sealed the drive in an evidence pouch. Dane connected it through a secure reader. Files populated the tablet. Contracts, payments, altered medical reports, physician signatures, hospital names. Kincaid appeared twice. Pruitt appeared once, not for payment, for burying Caleb's first complaint. Marla stared at Pruitt. You knew he reported this? Pruitt's voice broke. I thought he was paranoid. Caleb's hands moved slowly. That word again. Lily translated. He says that word is where lazy people put pain they do not want to understand. No one answered. The trauma surgeon arrived with a rapid team. Lily stepped back at once. Right tension pneumothorax decompressed. Needs chest tube. Possible infection at residual limb, fever, stress response, and rib trauma. Watch pressure. Last oxygen 89 on high flow. The surgeon looked from Kincaid in cuffs to Lily.
Who are you?
Marla answered. She is his nurse. Lily looked at her. Marla looked down. And we should have treated her like one. Caleb caught Lily's hand before they rolled him away. You stayed. She signed back. You were my patient. Before. The old guilt rose. She forced herself to face it. Before, too. Caleb shook his head. You did not make me deaf. I left you in that tunnel for 4 minutes. To save Ramos. To save Hale. To open the exit. You remember? I remember vibration. Smoke. Your hand on my vest. Your voice, before silence. Lily's eyes burned. He signed slower. I woke up deaf. I did not wake up alone. The doors closed behind him. Ward stepped beside Lily. Once this drive is authenticated, your sealed status collapses. I know. The people who hid you will want you moved. I know. Do you want extraction? Lily looked through the glass toward Caleb, then toward Marla, teaching an old volunteer the sign for water with trembling fingers.
No.
Ward watched her carefully. I am not asking as your captain.
Good, Lily said.
Because I am answering as a nurse. Dane approached with a phone. Federal prosecutors want a statement from Parker. Ward nodded.
Now.
Before Lily could answer, the speakers crackled. Code Silver, main lobby, security threat. Every face turned. Dane's radio exploded. Multiple armed suspects at front entrance. They're asking for Parker and Rourke. The first wave had failed. The second had walked through the front door. Marla whispered, "What do we do?" Lily pulled a clean scrubbed jacket over her torn sleeve. "We protect the patients." Pruitt stared from beside the guards. "They came for you." Lily walked past her. "No," she said. "They came through my hospital." The main lobby of Franklin, Virginia, was never built for war. It had flags, faded couches, a coffee kiosk, and framed photos of veterans with their families. Men in old unit caps sat under those photos every morning and argued about baseball, weather, and bad coffee. Now 4 armed contractors stood among them. One held an elderly volunteer by the arm. Another pointed a pistol toward the security desk. A third watched the elevators. The fourth shouted into a phone. "Parker, Rourke, bring the drive down or people get hurt." Lily watched from the second-floor balcony with Ward and Dane. She counted weapons, exits, hostages, sightlines. Ward whispered, "Federal tactical team is 9 minutes out. Too long. We hold." The volunteer is having chest pain. Dane stared. "You are diagnosing a hostage from up here?" "I am nursing from up here." The leader shouted, 30 seconds. Lily stepped into view. Ward caught her arm. "Sparrow." She pulled free. The lobby looked up. There was no music, no slow motion, just a tired woman in bright blue scrubs standing above men who thought weapons made them powerful. "I am Parker." The leader smiled. "Come down. Let the volunteer sit." "Not how this works. He is having chest pain. If he collapses, you lose your shield, you lose leverage, and every veteran in this lobby decides you are not leaving upright." The contractors looked around. That was their mistake. They saw old men. They did not understand them. One veteran slowly wrapped oxygen tubing around his fist. Another locked his wheelchair wheels. A third touched his cane like memory had placed it there. The leader shoved the volunteer into a chair. Lily walked down the stairs. Ward stayed 2 steps behind. "No weapon?" he asked. "I have a hospital." "That is not an answer." "It is if you know how to use one." At the bottom, Lily lifted her hands. The leader stepped close. "Where is the drive?" "Safe. With Rourke. With people smarter than you. You should have stayed buried." "So I keep hearing." His jaw tightened. Black current fed half the defense industry. Careers, contracts, promotions, all built on silence. Lily looked at the volunteer. "Sir, what is your name?" The contractor snapped. "Do not talk to him." The old man answered anyway. "Frank. Frank, chew this." Lily tossed him aspirin from her pocket. The contractor raised his pistol. That was the opening. From behind the coffee kiosk, Marla Finch threw a full metal coffee urn at his knees. It hit hard. Frank ducked. Ward moved. The lobby erupted. Veterans did not charge like young men. They disrupted. A cane hooked an ankle. A wheelchair blocked a retreat. Oxygen tubing tangled a wrist. Hot coffee hit a gun hand. Security guards surged from the side corridor. Lily went for the leader. He swung the pistol toward her face. She stepped inside the line, caught his wrist, and drove his hand down against the admissions desk. The weapon fell. He reached for her throat. For half a second, the tunnel came back. Smoke, concrete dust, Caleb's blood on her sleeve. Then Lily breathed once. Not there. Here. She turned his grip, used his momentum, and dropped him onto the tile. Ward cuffed the second contractor. Dane took the third. The fourth ran into federal agents coming through the revolving doors. It ended before the tactical team leader finished shouting commands. Frank slumped in the chair. Lily was already beside him. Chest pain 1 to 10? 6. Radiating. Left arm. Wheelchair. EKG. Oxygen. Notify cardiology. Lily called. Marla knelt beside her. I already called rapid response. Lily looked at her. Good. Marla swallowed. I mean it. Good. Frank blinked at them. You two always this exciting? Lily checked his pulse. Only on slow days. For the first time that morning, someone laughed. Not at Lily, with relief. Hours later, Caleb woke in a monitored room with a chest tube secured and 2 federal agents outside his door. Lily sat beside him, still in scrubs, still wearing the same watch over the scar he had recognized. His eyes opened. She signed before he could ask. Drive secured. Contractors arrested. Kincaid confessed enough to bury himself. Pruitt suspended. Frank survived. Caleb blinked. Frank. Volunteer. Heart attack starting. We caught it. Of course you did. The door opened. Captain Ward entered with 2 officials and a shaken hospital administrator. Ward stopped at the foot of the bed. Chief Rourke, your evidence has been authenticated. Federal warrants are moving tonight. Caleb nodded. Ward turned to Lily. Petty Officer, First Class Lily and Parker. United States Navy, Special Warfare. Medically retired under sealed protection order after Operation Blackcurrant. The administrator gripped her folder. Marla stood in the doorway, stunned. Trevor appeared behind her, eyes red. Ward continued. Silver Star. Navy and Marine Corps Medal. 2 Purple Hearts. Several classified commendations, still sealed. Hearing the truth in a hospital room felt stranger than hearing it under fire. Ward's voice hardened. This hospital placed her in a hostile patient encounter as a joke. That joke uncovered a federal conspiracy and saved this facility from a mass casualty event. No one spoke. The administrator swallowed. Miss Parker, Franklin, Virginia owes you an apology. Lily looked at Caleb, then at Frank's empty wheelchair by the hall, then at Marla's shaking hands.
No.
The administrator blinked. No. Apologies are words. I want policy. Ward's mouth twitched. What kind of policy? Every deaf and hard-of-hearing veteran gets qualified communication support. No more tablets tossed into rooms like substitutes for care. No patient gets labeled combative until someone documents how staff try to understand him. No student enters a room for entertainment. No staff member records a vulnerable patient. No nurse is punished for stopping harm. Marla began to cry silently. Trevor lowered his head. The administrator nodded. Approved. Written, signed, posted. Caleb signed from the bed. And training. Lily translated. Chief Rourke adds mandatory training. The administrator looked at him. Approved. Caleb signed again. Taught by her. Lily stared at him.
No.
His face looked far too innocent. Ward said, That is actually not a bad idea. It is a terrible idea. Marla stepped forward. I would attend. Trevor whispered. Me too. Lily looked at him. Trevor's face crumpled. I am sorry. I wanted them to like me. That is the whole reason. It sounds pathetic, because it is. You used a patient's disability as entertainment. I know. You helped isolate a wounded veteran. I know. You will carry that. Trevor nodded, crying. Good. Carry it into every room. Let it make you careful. Marla wiped her face. And me? Lily did not comfort her quickly. That would have made the lesson cheap. You started it. I know. Then stop teaching young nurses cruelty as a survival skill. Marla nodded. I will. Start with ASL classes. Yes. And never call him difficult again. Marla looked at Caleb. Never. 3 weeks later, Franklin, Virginia looked the same from outside. Same brick walls, same flag, same coffee kiosk where veterans complained that the muffins were too dry. Inside, things had changed. Room 12 had a new communication board. The staff lounge had an ASL training sheet with more names than expected. Dr. Kincaid's portrait disappeared from the Physician Excellence wall. Pruitt resigned before the hearing. Trevor Blake entered remediation. His final note to Lily was one sentence. "I will be better than I was that day." Marla stayed. That surprised Lily most. She expected excuses. Instead, Marla showed up early, stayed late, and practiced signs with an elderly Marine who corrected her without mercy. One afternoon, Lily found her in room 10, signing slowly to a deaf Vietnam veteran. "Pain where?" The veteran pointed to his hip. Marla saw Lily and froze. Lily nodded once. Not forgiveness. Recognition of work begun. Caleb recovered slower than he wanted and faster than his surgeon expected. He hated the chest tube, hated antibiotics, hated being told to rest, loved arguing silently with Lily because she argued back without pity. On discharge day, he stopped his wheelchair near the nurse's station, the same place where the joke had started. Caleb signed to Lily. "Translate exactly." His hands moved steady and clear. Lily's voice carried through the ward. "You thought silence made me weak. You thought her kindness made her weak. You thought a rookie nurse was safe to humiliate because she had no power here. You were wrong 3 times. My silence hurt more than your noise. Her kindness saw more than your arrogance. And power was never in your titles. It was in what you did when someone needed help." No one moved. Caleb signed one final sentence. Lily translated. "You did not give Lily Parker authority. Character did." Lily's throat tightened as she translated. Ward saluted her. Not dramatically, not for the room, just one soldier honoring another. Lily returned it. Then she lowered her hand and clipped her hospital badge straight. The badge still said Lily Parker, RN. No rank, no medal, no call sign. That was enough. Months later, people still told the story wrong. They said the rookie nurse turned out to be dangerous. They said the Deaf SEAL exposed a conspiracy. They said armed men came for a drive hidden inside a prosthetic liner. All of that was true, but it was not the heart of the story. The heart was smaller, crueler, more ordinary. A group of coworkers decided a patient's disability and a nurse's quietness were tools for humiliation. They expected laughter. Instead, they revealed themselves. That was the lesson Franklin, Virginia never forgot. Never mistake silence for emptiness. Never mistake gentleness for weakness. Never mistake a person's title for the measure of their courage. Because sometimes the person everyone mocks is the only one who has already survived the fire. Sometimes the patient no one listens to is carrying the truth. And sometimes the rookie nurse in bright blue scrubs is not hiding because she is afraid. She is hiding because the world once asked too much of her. Then one day, someone needs her again. And she steps forward anyway. If this story hit you the way it hit me, that's exactly what Fireside Files is here for, so subscribe and let me know in the comments where you're listening from.
The end.